Hi, you're welcome to another episode of your video teaching on the Good Head Tribe. I'm always excited to be here talking about something that you're going to be learning from, something you're going to be benefiting from, something that is going to open your eyes and open you up to new knowledge. My name is Atilola Monfulu, and today I'm going to be talking about Cradle Cap. So, yes, I am a certified trichologist. I'm a cosmetic scientist. I'm a hair care coach, both certified by the American Association of Drugless Practitioners. I'm the founder of African Naturalistas and the Good Hair Tribe. I've helped over 2,000 women and worldwide counting to grow long and healthy hair. I've been in the hair care industry for over 12 years, going on 13 years now, and I manage over 40 hair loss issues and scalp disorders. Yeah, that's me. Just summarizing what I'm about. That's not all about me. We're just giving a brief summary. So, today we are going to be talking about what exactly cradle cap is, the causes of cradle cap, how we can prevent them, and how to remove cradle cap if your child is suffering from one. So, what exactly is cradle cap? You hear the word cradle, so we are talking about children now. We're talking about babies, you're talking about infants, right? So cradle cap is a yellowish scaly crust that appears in patches on the scalp of young infants. So yes, it is the way seborrheic dermatitis presents itself in infants, and it's also called infantile seborrheic dermatitis. So you hear people say infantile seborrheic dermatitis or seborrheic dermatitis and all these things. In children, it is cradle cap, right? Yeah. So it usually presents itself in the first 3 months of life and usually regresses around within 6 months. So it's not something that stays long. It's not something that gives you trouble like a constant scalp disorder. It comes within the first 3 months. Of course, not all children have cradle cap, but some do, and then it is not really common in older children. So you hardly see somebody of 1 year old, 2 years old, 3 years old, and above having cradle cap. Some do, but it's actually very rare. So they are mostly in babies, like newborn babies. Hence the word cradle, because they are still in the cradle around that particular point in time. All right. So how do you recognize cradle cap? Right. It's usually greasy, yellowish, scaly. Right. So they are flake. They are like thick flakes. Right. On the scalp of the child, and then many times is usually accompanied by red scaly rash around the eyebrows, between the eyes, central facial region, and the folds behind the ears. Most times you actually find that they might not be as big and visible as this baby in this picture, but you find them around the eyes sometimes. Sometimes they don't come around the eyes at all, so it's not like they must come, but they are usually accompanied by those skills. And of course, if it's a black Caucasian, I mean a Negroid child, it will not necessarily be red like it is in this picture. It might be blackish and all, or pinkish, depending on the complexion of the child, right? And then you might see it in the flexure areas of the child, the elbows, the knee folds, that's the inner elbows, the knee folds, all those areas where there's flexing occurring, you will find it there. You get, so those are the signs that you can tell, oh, this is cradle cap, right? And then what exactly are the causes of cradle cap? So the causes are inconclusive, but they have been linked to maternal androgens. So there's a lot of research being done, a lot of fact finding, but so far they have linked it to the androgens in the mother, right? However, I want to believe that one of the reasons why they don't really pour so much funds into bringing the causes of cradle cap to fore is because cradle cap is not harmful and it's not long term. So it really doesn't hurt the baby, it doesn't hurt the mother, it doesn't hurt anyone in the long run. You get, so unlike cancer and then some serious scalp disorders that lead to permanent scarring and everything, cradle cap is not that way, right? So how exactly has it been found that cradle cap happens? Right? So the mother's hormones stay in the baby's body for some months. That's the androgens I talked to you about. And then they begin to cause the baby to have too much overactive sebaceous glands, right? So you have already given birth to the body, to the baby, sorry. But those hormones, right, that the mother transferred to the baby are still residual in the child's body even till some months after birth, right? And then these hormones, which are not supposed to be in children, they're adult hormones, right? They begin to cause the baby's sebaceous glands to be overactive. If you are not sure about what sebaceous glands are, they're actually the glands that produce sebum in our body. So we have what we call the oil glands and the sweat glands. So in on your skin, your scalp and everything, your body is supposed to excrete. So you don't actually sweat only water. You actually sweat both water and oil. That's why you see some people's faces, and you say, oh, you have oily skin. And some people's faces you say you have dry skin. That's because their skin does not produce a lot of oil. So you say, oh, you have dry skin, oh, you have oily skin and everything. But that oil glands, they're actually called sebaceous glands because the thing that comes out of those glands are actually what you call sebum, right? So when the sebum are when this thing happen in the baby's body, right? You have what you call the overactive sebaceous glands. It's producing too much sebum. It's producing too much oil, and then because of that, you remember at this point, the baby cell is supposed to be replicating like fast enough, right? Because the baby is still shedding quite some amounts of skin. They are still coming, still living, shedding their old skin that they came with from the womb and all those things, right? But because of the production of this sebum, right, this too much production, there's a trapping that occurs, right? So this sebum prevents the old skin cells from drying and falling off. So it's not able to dry. That's the old skin cells that the baby comes with. It's not able to dry, it's not able to fall off. So there's a trapping of the sebum in those skin cells, and then they end up sticking to the scalp, and then they give you something like a cradle cap, right? And then it begins to form that flake that you manually need to take off and remove and everything because so much oil and so much skin, and they form the cap, right? So, how exactly do we prevent it? So, it is not preventable, right? Because we cannot really go into the mother's body to find out how she's passing those hormones to the baby and everything. So, it's not preventable condition right now because you're still working on it, still fine tuning how the passage of the hormones occur, and then yeah. So there's really nothing to do to prevent it, but mild cases of cradle cap will disappear on its own. Mild cases will actually disappear on its own. And if you think it's very serious, like this cradle cap has now turned into an infection, it's now so serious, you cannot lift the cap and all those things, then you can begin to see a pediatrician, a doctor, and everything that can gently help you lift it and then apply antibiotics to it. But in most cases, in 9.9999% of cases, those cradle caps actually disappear on their own. But we mothers, we are not interested in waiting for any cap to disappear on their own for us to seem like we are not taking care of our children, to make it look like we are dirty. We didn't give them the right products, we didn't give them the right nutrition, we didn't give them all those things, and instead we want to take power into our own hands. And that's where this next slide comes in. How exactly do we remove the cap, right? So this is like one of the safest way to remove the cap. So you will mix jojoba oil, what some people call jojoba oil. You can mix it with a very light carrier oil, like 50-50 in equal proportions, right? You mix it very well. So jojoba oil is very good because it has it regulates the sebum, right? If I could do it today, I think I will mix jojoba oil with palm kernel oil. If you can stand the smell of really, really original black palm kernel oil, because the palm kernel oil also has healing properties, right? So when you leave the cap, it will also, heal that area and make the skin, supple skin cells appear very fast. So yeah, so you can mix it with jojoba oil, jojoba oil mixed with coconut oil in equal proportions, or you use I said castor oil. Use pumpkin oil. You can use avocado oil, grapeseed oil. Those are very light carrier oils, right? You mix it and then you saturate the cap. You let the cap, that's the cradle cap, those very thick flakes, those very thick flakes. You let the oil saturate those thick flakes, right? And then it will be more pliable. You don't want to lift those flakes when they are hard, they're crusty, and because you don't know how it has merged with the child's skin, and you don't want any infection to happen, right? So you just saturate them, and then you get a fine toothed comb, right? This is the time you're allowed to use a fine tooth comb, right? Use the fine tooth comb, and then you comb through you comb those flakes up. You remove, you see them that once they're already saturated, those flakes will start lifting easily. You're not forcing anything. I know your baby's hair is still curly, still looking really nice and everything. So you're going to lift like the one in this picture, right? So you're going to lift those flakes easily. Just take it up, just take it up, just take it up. I just use the comb to lift them, and everything will fall off. Everything will come out, right? Be very careful not to lift flakes that are dry. It's always, of course, some people lift them while dry, but you want to be very careful that you don't lift them while dry and everything. So you just use the fine tooth comb to comb out. And this process is usually a very painless one. Your baby doesn't feel any pain. It doesn't feel like you have injured the child, or you have made the child's scalp bleeding and everything. So you just want to be very careful that you saturate it well, so you don't put your child through any trauma that was even unnecessary in the first place. Some people also use things like, during the wash session, they use the massaging brush to gently massage that area with shampoo and then comb it out. Anyone that rocks your boat, but is all for, with better knowledge, it's always good to saturate it with jojoba oil and a light carrier oil or any healing oil. Okay, so that is the end of today's session. What I want you to do is, let's quickly do a recap of this. And then we said it is a cradle cap is yellowish scaly cross that appears in patches on the scalp of young infants, and it's called infantile seborrheic dermatitis. It usually presents itself in the first 3 months of life and usually regresses within 6 months, and it is less common in older infants. And also, we talked about how you can recognize it, other parts of the body which it presents itself in babies. We also talked about the causes, right? That it has been linked to androgen, maternal androgens, and how it actually happens when there's an overload of those hormones in the child's body, and then it begins to block out. It's not able, the cells are not able to replicate, the cells and the sebum mix, and they form what do they call it? They form a cap. They form a very flaky crust right on the child's head. We also talked about the fact that there is no prevention for it, and then we talked about how to remove the cradle cap by lifting the cap after saturating that area with with jojoba oil and a lighter carrier oil, of which I always like pumpkin oil because of its healing properties along with the jojoba oil. So yes, that is the end of today's teaching. I'm very sure that you have learned something new today. You have learned something great, and then you'll be implementing this on yourself, your children, or your clients out there. So if you have any questions, please do not hesitate to ask in the WhatsApp group, in the Facebook group, and then we'll be there to take your questions. Also, please drop a comment in the comment section. Remember, we are actually rating your comment dropping skills. So please drop a comment in the comment section, ask a question, give us a suggestion, give us a light bulb moment, whatever you do, please talk. Till I come your way again in the next episode or in the next video teaching. My name is Atilola. Ask your questions and I will see you. Bye.